This segment is sponsored by Goodwin Living. November is National Hospice Month, and while we know this can be a topic that's a sensitive one, it's also a necessary conversation to have so that patients and their families know the services that are available to them. Goodwin Hospice offers end-of-life care in the comfort of your own home. And here to tell us more, we actually have the medical director, Dr. Margaret Gloria. Dr. Gloria, thank you so much for being here today.
Thanks for having me.
I imagine this is a tough conversation. It's almost like picking life insurance or doing your will, right, at this point?
Absolutely.
How do you suggest families even begin to have this conversation?
So it's really important to have a conversation early. It's important to have open conversations about what really is important to you, what your wishes are at end of life.
Yeah. What for people who maybe don't even know, what is hospice care? I guess we should.
Hospice is technically an insurance benefit, but really it's so much more than that, and I'll explain. So hospice, the core benefit includes 24/7 access to nursing and physician services. So you have a regular hospice nurse that knows you well and comes in and checks on you with some regularity, but if you have a problem in the middle of the night, if it's 2 o'clock in the morning, you just pick up the phone and call us. We're always there.
Wow.
Hospice includes social work, bereavement, chaplaincy, volunteers, aides, durable medical equipment. So if you need a hospital bed, we can provide that. We also provide any medication that is related to your hospice plan of care. In addition to all of that, a lot of agencies will have additional or complementary services. So for example, at Goodwin Hospice, we have massage therapy for patients and families. We have a volunteer choir that will come to bedside and sing. Yeah, it's very sweet. And we have end-of-life doulas if that's something the family's interested in, and it's all included in that hospice benefit. So hospice is really an interdisciplinary model of healthcare that's designed specifically for someone who's either at or approaching end of life who wants to remain comfortably in their home setting.
How do you know when it's the right time to give you a call? I imagine that's difficult on that timeline, not knowing, okay, is now the right time? What would you recommend?
That's a great question. And one of the most common points of feedback that I hear from patients and families is, I wish we had called sooner, which is heartbreaking to hear.
Yeah.
Hospice is technically designed for somebody that has a life expectancy of 6 months or less, but that's really hard to know when that's the case, even for us doctors. So what I would say is, if you're even thinking about hospice services, now is the time to look into it. You can do that one of two ways. You can either talk with your doctor, or you can just call the hospice agency directly and make a self-referral for yourself or on behalf of your loved ones. Always better to call us too early than too late.
And at least they're on your radar now.
Exactly.
You can kind of follow their journey and say, okay, now's the time.
Yep.
I sometimes feel like there's a stigma around this. We kind of mentioned that off the top, like not a comfortable conversation to sometimes have, but what is that stigma with hospice care?
So hospice deals with an uncomfortable topic, which is our own mortality. In our society, death is often seen as avoidable. In medicine, it's seen as a failure. Oftentimes, accepting death is seen as giving up, but that is not what hospice is about. I've had patients enroll in hospice and go on cruises. I've had patients finish writing books. I've had patients reconnect with long-lost loved ones, and so on and so on and so on.
Wow.
There is so much life to live, even if you're facing a life-limiting illness, and that is exactly what hospice is all about.
Those are like all big bucket list items that they're doing while on hospice. 3 things real quick that a person maybe should know about hospice care.
Hospice is patient-centered. Hospice supports not just the patient, but whoever their support system is. So your family, your caregivers, your friends, whoever it is. And hospice is not a place. Hospice is a bunch of services that come to you.
Yeah, you mentioned you come to their home, right? And you bring all of these great medical expertise and equipment.
Yep.
Wow, excellent. Thank you so much. Where do we go to get more information, to reach out and start that process, even if people say, I don't know if now's the right time?
Yeah.
Obviously they want to talk to you.
So if you're looking for more general information about hospice, you can always go to our website. That's goodwinhospice.org. Or you can also go to the National Hospice and Palliative Care Organization's website. That's nhpco.org.
Okay.
If you're interested in hospice services and you're thinking more about which agencies provide area in your care and you want to see what their ratings are, you can go to Medicare's Care Compare website. And so that's medicare.gov. You just click Find Providers and then use the drop-down box to narrow your search for hospice providers.
Okay, excellent. Thank you for all the information today, for starting this conversation, maybe especially for people at home listening. Again, for more information about their hospice services, you can go to goodwinhospice.org. Start there and then find all the other benefits you were talking about.